Countries around the world are becoming increasingly concerned over the use of social media by children. Australia took some of the strictest moves last month as it passed a landmark law banning children under 16 years old from social media. Now, the law only kicks in later next year, but it already has many other nations thinking along the same lines. Among them, Norway, France, Sweden, as well as Indonesia. But what about Singapore? Are its young people equally at risk? I have with me two experts for a closer look at the issues at play here. Dr. Daniel Fung is CEO of the Institute of Mental Health. Also joining us is Ms. Nicole Pang, Head of Services at Impart SG, a that works with youth and children. Welcome to the show. My first question would be for the both of you. How far should Singapore be concerned about our children's digital habits and why? Perhaps, Dr. Fang, you can start.
Well, I think digital is part of the new social norm today. But the timing is important. I mean, we know that screen times for young children, infants, toddlers are not appropriate. But what about older kids, and as they go to school, how do they interact with the digital life and what does it mean for them? It's a productivity tool, it's also information. We just have to be careful about its use so that it doesn't overwhelm them, because there are developmental phases that one has to go through, particularly around relationships and the internet, the vast globalized connectivity through that does present some challenges for young people learning to navigate their relationships.
Ms. Pang, what about you? What are your thoughts on this? Why and to what extent should the digital habits of our children be of our concern?
Right. I think to acquire digital habits as you grow up is one thing. It's another thing to be born into these digital habits. And so there's so much noise and unfiltered content that's available on social media as well. And our children are immersed in it every single day and at every stage of their lives. And so it's important to have conversations surrounding, how much social media usage should be available to children and youth.
And these apps that have been identified by Australia, we are looking at Snapchat, TikTok, Facebook, Instagram, X. Australia has considered these apps to be of concern, but these are also platforms that have become so ingrained in our young people's lives. What is Singapore's good and bad experience with our children using such platforms?
Right. I think one of the biggest good things would be that they gain a lot of information and knowledge through these platforms. And it goes beyond what's being taught at schools and homes sometimes. And social media is also a tool that increases connectivity, right? Impart's mental health care arm, for example, was created because children and youths were in the community. They didn't know where to seek help, and so they reached us through social media for support. The bad thing it also surrounds connectivity and spreading information, right? We hear often of dramatic cases like, obscene photographs, young children being spread rampantly. We are also dealing not only with unfiltered content, but also a lot of unfiltered advice. So many voices telling you what to do, and then for some of these children and youths, they may not just have a safe adult that can guide them in terms of discerning what's good advice, what's bad advice. Yeah.
So it's really a boon and a bane, especially for our children on the digital space. Dr. Fang, some of the conversations online have argued that social media bans are unlikely to work. They say the move is ambitious, it is not as simple to implement. How would you address these concerns, and what do we gain if we do keep our young children away from social media?
A ban is a top-down effort, really telling everyone to stop something. I much rather we ban smoking, for example, because these are real dangers. Social media has positives. What I think is important is supervision, monitoring, and the conversations with young people as they learn about this new ways of communicating. And that's where adults and caregivers, they play a role. I think it's important that parents understand this. If they don't understand what you just said, Snapchat, all those various Facebook, and I think adults know Facebook, but they may not know the other forms of social media, then they ought to educate themselves and be kind of prepared for this as a young person, especially if they're going to give them a smart device like a smartphone where you have access.
So do you think Australia's move here is very drastic? Is it a good or a bad move, you think?
I think it's drastic. It was surprising. The evidence of social media being a bad thing is still being discussed. I think there's quite a bit of debate today. The science around trying to study a social phenomenon and then trying to implicate it as cause for mental illness, for example, is a bit premature, I would say. I think a very recent meta-analysis, which is a kind of a review of all the literature that's out there, doesn't suggest that it's directly harmful. It might be that if you are more prone to an illness, you might be actually going to social media a lot more. So that causal link may not be established. So I'm a bit careful about trying to say, okay, this is really bad. So you make a decision to ban something because it's a social phenomenon. It's based on other factors, but certainly not the science.
Okay, there's a very good point there that you just made. Ms. Pang, earlier you talked about the exposure to unhealthy content when children get onto social media. We've heard of the negative impacts also of using excessive social media. What are the main problems that you are seeing stemming from an all too early use of social media?
Right. I think one of the things we really see on the ground would concern coping mechanisms. Social media and device usage are almost the default, coping mechanisms for a lot of children and youths. They turn to their devices when they are having big emotions in order to kind of distract themselves or soothe themselves. And this also means that in very difficult or stressful situations, they find it hard to cope without their devices. And we've found that on the ground at Impart, as we are working with children and youths, we've had to help a lot of them to actually unlearn this over-reliance on devices and relearn healthy coping mechanisms.
What about cyberbullying? I mean, that is something that has been discussed quite often also.
For sure, it's a big one. And I think with regards to just different platforms, the level of control and the standards are also very different in terms of the restrictions and how they are filtering the content. And so, it's with regards to cyberbullying, it really goes to quite a huge extent because of that.
Actually, bullying is about 10% of kids get bullied. But cyberbullying presents the whole world in global kind of settings. And that's the risk, I think, that social media presents. Whereas in traditional bullying, you're in a classroom, you're in a school setting, usually, and it's a limited number of people. Cyberbullying is much riskier because of the global ability to snowball into something really bad.
Sure. And Dr. Fang, you also did a study on how excessive use of social media appears to be linked to the mental health of children and youth. What were the key findings of this study? What stood out to you the most?
That's not my study, but it's from our institute.
Sure.
I think we were trying to look at social media use. I think, and we measured excess as something more than 3 hours of use. And of course, 3 hours is actually probably a lower end of what people may use social media, depending on how much accessibility is. And we found that kids with mental illnesses are more likely to use higher social media. But that goes exactly with the point that when a young person is having a mental health issue or a mental health condition, they're more likely to use social media.
All right.
That doesn't necessarily mean that it causes mental illness.
Dr. Fang, Ms. Pang, I wish we can talk longer on this topic, but thank you so much for coming in to share your perspectives with us. That was Daniel Fang, CEO of the Institute of Mental Health, and Ms. Nicole Pang, Head of Services at Impart SG.